Hey, it's Dr. Alan Mandell, and I want to ask you something important right from the start. Do you ever wake up in the morning and feel that strange tingling in your fingers, like your hand fell asleep, but it didn't? Or maybe there's a burning sensation in the bottoms of your feet that just won't go away, no matter how much you rest? Maybe your hands feel numb when you're trying to button your shirt. Or your feet feel like they're wrapped in cotton. Or, and I hear this from so many of my patients over 60, you feel those sharp, electric like shooting pains that seem to come out of nowhere, even when you're just sitting still. If any of that sounds familiar, I need you to watch this video all the way through. Because what I'm about to share with you today could genuinely change your life. Here's what most people don't know. Over 20 million Americans are living with peripheral neuropathy, damage to the nerves outside of the brain and spinal cord. And the majority of those people are over the age of 60. That means if you're watching this right now, there's a very real chance that you or someone you deeply care about is dealing with this right now. Now, here's what your doctor may not be telling you. Most conventional treatments, I'm talking about gabapentin, Lyrica, pain patches, they mask the symptoms. They quiet the pain signal, but they do absolutely nothing to fix the actual nerve damage underneath. You're treating the smoke, not the fire. What I'm going to show you today is different. There are 6 specific vitamins backed by real clinical research that have the power to actually nourish, protect, and in many cases, help reverse nerve damage. Not cover it up, reverse it. These are nutrients your nerves are literally starving for, and most people over 60 are deficient in at least 2 or 3 of them without even knowing it. So stay with me. Because whether your nerve issues are mild or severe, whether you've had them for months or years, this information is going to give you a real path forward. And if you find this helpful, please hit that like button, share this video with a family member or friend who's been struggling, and subscribe to Healthy Aging America so you never miss a video like this one. All right, let's get into it. Before we get to the vitamins, I want to spend just a couple of minutes explaining what's actually happening inside your body. Because once you understand this, everything else is going to make so much more sense. Think of your peripheral nerves like electrical wiring inside your walls. They carry signals from your brain all the way out to your hands, your feet, your legs, and arms. Now, wrapping those wires is something called the myelin sheath, a protective coating, almost like the plastic insulation around an electrical cord. When that insulation gets damaged or starts to break down, the electrical signals get distorted. They misfire, they slow down, and that's when you start feeling things like tingling, burning, numbness, or that awful pins and needles sensation. So the question is, what's breaking down that protective coating in the first place? After the age of 60, several things start working against you, all at once. Number 1, diabetes and high blood sugar. High glucose levels are toxic to nerve tissue. They damage the tiny blood vessels that feed your nerves, slowly starving them of oxygen and nutrients. Number 2, nutritional deficiencies. As we age, our digestive systems become less efficient. We produce less stomach acid. We absorb less of what we eat. So even if you're eating reasonably well, your body may not be pulling out the vitamins and minerals your nerves desperately need. Number 3, medications. This one surprises a lot of people. Common drugs that millions of older Americans take every day, metformin for diabetes, statins for cholesterol, and proton pump inhibitors for acid reflux, They actively deplete key vitamins, especially B12. We'll talk more about that in just a moment. And number 4, poor circulation. Without adequate blood flow reaching your extremities, your hands and feet simply don't get the nourishment they need to repair themselves. Here's the good news. Many of these causes are directly addressable through nutrition, and a simple blood test from your doctor can tell you exactly where your deficiencies are. So ask for one, because knowing is the first step. Now, let's talk vitamins. If I had to choose just one vitamin for nerve health, just one, it would be vitamin B12, without question. Here's why this matters so much. B12 plays a central, irreplaceable role in building and maintaining that myelin sheath we just talked about, the protective coating around your nerves. Without adequate B12, that coating literally starts to deteriorate. And once it deteriorates, those nerve signals get distorted and you get numbness, tingling, weakness, and pain. But here's the thing that should concern every one of you watching right now. B12 deficiency is extraordinarily common in people over 60, and most people have absolutely no idea they're deficient. Why? Because of something called atrophic gastritis. As we age, many of us produce less and less stomach acid, and you need stomach acid to extract B12 from food. Less acid means less absorption. It's that simple and that serious. And if you're taking metformin for type 2 diabetes, listen carefully. Metformin is known to deplete B12 levels significantly. Studies show that up to 30% of long-term metformin users have B12 deficiency. If that's you, please ask your doctor to check your B12 levels at your next appointment. Now, when it comes to B12 supplements, the form matters enormously. Most cheap supplements use a form called cyanocobalamin. It's synthetic, it's inexpensive, and your body has to do extra work to convert it into a usable form. The form you want is called methylcobalamin. This is the active, bioavailable form. Your body can use it immediately, and research shows it has a particular affinity for nerve tissue. Even better, consider the sublingual form, a tablet you dissolve under your tongue. Because it's absorbed directly into your bloodstream, bypassing the digestive system entirely. This is especially important for older adults whose absorption is already compromised. As for food sources, B12 is found in animal products. Beef liver is the richest source, followed by salmon, sardines, tuna, eggs, and dairy. If you're vegetarian or vegan, supplementation is not optional. It's essential. My recommendation: talk to your doctor about getting your B12 serum levels tested. A level below 400 picogram per milliliter may be suboptimal for nerve health, even if it's technically in the normal lab range. Vitamin B6 is next on our list, and this one comes with a very important warning that I don't want you to miss. B6, also known as pyridoxine, is essential for producing the neurotransmitters your nervous system depends on to communicate properly. We're talking about serotonin, dopamine, and GABA, the chemical messengers that regulate mood, pain signals, and nerve function. Without adequate B6, that entire system starts to malfunction. Here's what the research shows. A deficiency in B6 is a well-established cause of peripheral neuropathy. The symptoms look almost identical to what we've been describing: numbness, tingling, burning, especially in the hands and feet. But here's the part I really need you to pay attention to. Too much B6 also causes neuropathy. I want to say that again, because this is a mistake I see people making constantly. Taking high-dose B6 supplements, we're talking anything above 100 to 200 milligrams per day over an extended period, can actually cause or worsen nerve damage. It's one of the very few vitamins where excess is genuinely harmful to the nerves. So there's a sweet spot here. You want enough, but not too much. Most adults need somewhere between 1.7 and 2 milligrams of B6 per day from food sources. If you're supplementing, aim for a modest dose in a B complex rather than a high-dose standalone B6 supplement. And when you do supplement, look for the form called P5P, or pyridoxal 5-phosphate. This is the active, already converted form of B6, the form your body actually uses, and it's much better absorbed, especially for older adults whose ability to convert standard pyridoxine may be reduced. Food sources for B6 include chicken breast, turkey, salmon, tuna, potatoes, bananas, and chickpeas. These are all excellent, safe ways to keep your B6 levels in a healthy range without any risk of overdose. Vitamin B1, also known as thiamine, is one of the most critical nutrients for nerve function, and one of the most underappreciated. Here's its primary role. B1 is essential for glucose metabolism inside nerve cells. Think of it as the key that helps your nerves properly use the energy from sugar. When B1 levels are low, nerve cells essentially start to struggle with energy production, and they become far more vulnerable to damage, particularly from elevated blood sugar. This is why B1 deficiency is especially devastating in people with diabetes or prediabetes. High blood sugar generates toxic compounds called advanced glycation end products, or AGEs. These AGEs directly attack nerve tissue, and B1, specifically in its superior form, actually helps block this process at the cellular level. Now, I said its superior form, and here's what I mean by that. Regular thiamine, the kind in most B-complex supplements, is water-soluble. That means your body can only absorb a limited amount of it at a time, and it passes through fairly quickly. But there's a fat-soluble form called benfotiamine, and this is the game changer. Benfotiamine is absorbed up to 5 times more effectively than regular thiamine. It crosses cell membranes more easily, including into nerve cells, and it stays in your tissues far longer. Multiple clinical studies, particularly in patients with diabetic neuropathy, have shown that benfotiamine supplementation significantly reduces pain, improves nerve conduction, and helps protect against further nerve deterioration. In fact, one study published in Experimental and Clinical Endocrinology and Diabetes found that benfotiamine supplementation significantly reduced neuropathy symptoms in diabetic patients after just 12 weeks. That's real, measurable improvement. Food sources of thiamine include whole grains, legumes, pork, and sunflower seeds. But for therapeutic purposes, dietary intake alone is rarely enough. Benfotiamine as a supplement is where the real clinical benefit comes from. If you have diabetes, prediabetes, or a history of heavy alcohol use, which also depletes B1, please ask your doctor about benfotiamine specifically. This is not a vitamin to overlook. Let me ask you a question. When was the last time you had your vitamin D levels checked? Because here's a statistic that genuinely shocks most people. Studies suggest that somewhere between 60 and 80% of adults over the age of 60 are deficient in vitamin D, and the vast majority of them have no idea. We tend to think of vitamin D as the bone vitamin, important for calcium absorption and skeletal strength, and it is. But what most people don't realize is that vitamin D receptors are found throughout the nervous system. Your nerves, including your peripheral nerves, depend on adequate vitamin D to function and to heal. Here's specifically what vitamin D does for your nervous system. First, it has powerful anti-inflammatory effects. Chronic low-grade inflammation is one of the primary drivers of peripheral nerve deterioration, and vitamin D helps suppress those inflammatory pathways. Second, vitamin D plays a role in the production of nerve growth factor, a protein that literally supports the survival and regrowth of nerve cells. And third, it helps regulate the immune system, which is critical in cases where neuropathy has an autoimmune component. Multiple studies now show a strong correlation between low vitamin D levels and the severity of neuropathy symptoms. One study found that neuropathy patients with the lowest vitamin D levels experienced significantly more pain, more numbness, and worse overall nerve function scores compared to those with adequate levels. Here's what you want to ask your doctor. Request a 25-hydroxy vitamin D blood test. Ideally, your level should be somewhere between 50 and 80 nanograms per milliliter. Many labs consider anything above 30 normal, but for neurological and immune health, higher is better within a safe range. When supplementing, always choose D3, not D2. D3 is the form your body naturally produces from sunlight, and it's far more effective at raising your blood levels. And pair it with vitamin K2, specifically the MK7 form. K2 ensures that the calcium mobilized by vitamin D gets directed to your bones, not deposited in your arteries. Get outside when you can. Even 15 to 20 minutes of midday sun on your arms and legs helps your body produce vitamin D naturally. And load up on fatty fish, egg yolks, and fortified foods as dietary sources. Your nerve cells, like all cells in your body, are enclosed in membranes made primarily of fat. And fat is vulnerable to something called oxidative stress, essentially damage caused by unstable molecules called free radicals that attack and degrade your cell membranes over time. This is where vitamin E comes in. Vitamin E is one of the most potent fat-soluble antioxidants in nature. It acts as a direct shield for those fatty nerve cell membranes, neutralizing free radicals before they can cause damage. Think of it as a bodyguard for the outer wall of every single nerve cell in your body. Research has shown particular benefits in two groups. First, individuals undergoing chemotherapy. Chemo-induced peripheral neuropathy is a devastating side effect of cancer treatment, and several studies have found that vitamin E supplementation significantly reduces both the incidence and severity of nerve damage in chemotherapy patients. Second, people with diabetes-related neuropathy. Oxidative stress is dramatically elevated in people with high blood sugar, and vitamin E helps neutralize that excess oxidative damage before it can harm nerve tissue. Now, and this is important, not all vitamin E supplements are created equal. Most cheap products on the market contain only one form of vitamin E, called alpha-tocopherol, and many of those use a synthetic version labeled DL-alpha-tocopherol. The DL tells you it's synthetic. Your body doesn't use this form nearly as well. What you want is mixed tocopherols, a product that contains all 8 natural forms of vitamin E, including alpha, beta, gamma, and delta tocopherols and tocotrienols. This mirrors what you'd get from food and provides much broader antioxidant protection. Excellent food sources of natural vitamin E include almonds, sunflower seeds, wheat germ, avocados, and spinach. These whole food sources give you the full spectrum of tocopherols naturally. And now we come to what I consider one of the most powerful and fascinating nutrients on this entire list: alpha-lipoic acid, or ALA. Let me start with something that gives you a sense of how significant this compound is. In Germany, alpha-lipoic acid has been used as a prescription medication for treating diabetic neuropathy for over 30 years. Not a supplement, a prescription drug. That should tell you something about the level of evidence behind it. What makes alpha-lipoic acid so unique is that it is both water-soluble and fat-soluble. Most antioxidants can only work in one environment, either in the water-based fluid inside cells or in the fatty cell membranes. ALA works in both. This gives it extraordinary reach throughout the entire nervous system. Here's what the research consistently shows. ALA improves nerve conduction velocity, meaning it actually speeds up the rate at which nerve signals travel, which directly addresses the slowdown caused by nerve damage. It reduces neuropathic pain, burning, and tingling. And it helps regenerate other antioxidants, including vitamins C and E, essentially recycling your body's entire antioxidant defense system. A landmark study called the Sydney Trial, which involved over 300 diabetic patients with peripheral neuropathy, found that intravenous ALA significantly reduced neuropathy symptoms after just 3 weeks. Oral supplementation has also shown meaningful benefits in multiple follow-up trials. Now, when choosing an ALA supplement, look for the R-ALA form, short for R-alpha-lipoic acid. This is the biologically active form, the form naturally produced in your body. Many supplements use a racemic mixture of R and S forms. R-ALA alone is more potent and better absorbed. One important caution: alpha-lipoic acid can lower blood sugar levels. If you're taking medication for diabetes, please monitor your blood glucose carefully and talk to your doctor before adding ALA. The dose needs to be managed properly. Take ALA on an empty stomach, at least 30 minutes before a meal, for best absorption. Typical supplemental doses used in research range from 300 to 600 milligrams per day. This is a supplement that I believe every person dealing with peripheral neuropathy should at least discuss with their doctor. The evidence is that compelling. All right, we've covered all 6 vitamins, but before I wrap up, I want to give you a few practical bonus strategies that can dramatically amplify everything you've just learned. Because vitamins alone are powerful, but combined with these habits, you're going to see real results faster. Tip number 1. Stack the B vitamins together. B1, B6, and B12 work synergistically. They don't just each do their own job in isolation. They actively support each other's function in the nervous system. Instead of taking 3 separate supplements, consider a high-quality B complex that contains all 3 in their active forms. Benfotiamine instead of plain thiamine, P5P instead of pyridoxine, and methylcobalamin instead of cyanocobalamin. Read the label carefully. The form matters. Tip number 2. Walk every single day. I cannot stress this enough. Even a modest 20-minute walk once a day significantly improves blood circulation to your peripheral nerves. More circulation means more oxygen, more nutrients, and faster removal of inflammatory waste products from nerve tissue. Your feet and hands need blood flow to heal. Don't give them the sedentary environment that makes neuropathy worse. Tip number 3. Try Epsom salt foot soaks. Dissolve 2 cups of Epsom salt, which is magnesium sulfate, in a warm foot bath and soak for 15 to 20 minutes. Magnesium is absorbed through the skin, and magnesium deficiency is extremely common in older adults. Magnesium plays a role in nerve signal transmission and muscle relaxation, and many people with neuropathy report noticeable temporary relief from this simple practice. Tip number 4. Cut the sugar and processed foods. I know you've heard this before, but I'm going to say it again because it's that important. Excess sugar is the single most damaging dietary factor for peripheral nerves. It drives inflammation, produces those glycation end products that destroy nerve tissue, and depletes the very vitamins we've been discussing. Reducing your sugar intake, even modestly, combined with increasing your vitamin intake, is a 1-2 punch that can make a profound difference. Tip number 5. Talk to your doctor about a full panel. Ask for these specific tests at your next appointment: serum B12 levels, a 25-hydroxy vitamin D test, a hemoglobin A1C, and a complete metabolic panel. These tests are simple, inexpensive, and give you the real data you need to target your deficiencies precisely. Don't guess. Know. All right, my friends, let's bring it all home. Today we talked about 6 remarkable vitamins that your nerves need to heal, protect, and regenerate. Let me count them on my hand one more time so you have them locked in your memory. 1. Vitamin B12 as methylcobalamin, the master nerve rebuilder. 2. Vitamin B6 as P5P, the neurotransmitter supporter, but get the dose right. 3. Benfotiamine, the superior form of B1, especially critical if blood sugar is a factor. 4. Vitamin D3 paired with K2, the inflammation-fighting, nerve-protecting sunshine vitamin. 5. Vitamin E as mixed tocopherols, the protective shield for every nerve cell membrane. And 6. Alpha-lipoic acid, the universal antioxidant, used as medicine in Europe for good reason. I want to leave you with this thought because I mean it from the bottom of my heart. Nerve damage is not a life sentence. Yes, nerves heal slowly. Yes, it takes consistency and time. But your body has a truly incredible capacity to repair itself when you give it the right tools. Millions of people have taken control of their neuropathy through targeted nutrition. People who were told they just had to live with it. Don't accept that answer. Start with your doctor. Get your levels tested. Make small, consistent changes. And give these vitamins time to work. We're talking weeks to months, not days. You deserve to feel your feet on the ground again. You deserve to button your shirt without struggling. You deserve to sleep through the night without burning pain waking you up. And I believe, with the right knowledge and the right nutrients, that is absolutely possible for you. Now, please do me a favor. Share this video with someone you care about who's been struggling with neuropathy. You might just change their life. Hit that like button if you learned something today. And subscribe to Healthy Aging America so you're notified every time I release a new video. I'll see you in the next one. Take care of yourselves and take care of each other. This is Dr. Alan Mandell, reminding you that the best medicine begins with knowledge.